Before we dive into today's insightful discussion, I want to share some updates that will enhance your Fempower Health experience. We're excited to launch our new interactive newsletter. This weekly newsletter is packed with the latest scientific findings, business insights, and essential updates in the realm of women's health. Signing up is easy. Just visit our website or click the link in the show notes. Our website is also a comprehensive resource organized by topic for your convenience. Whether you're delving into the latest research, exploring any trends in healthcare, or seeking information in specific health topics, it's all there at your fingertips. Additionally, for our Spotify users, we've created playlists categorized by these topics, offering you another way to stay informed and engaged. And for those listening on Apple Podcasts, while we can't categorize content within the app, our website remains a central hub for all of these resources. And be sure to take advantage of these tools to stay on top of the evolving world of women's health, science, and business. Now let's get started with today's episode. This is Fempower Health. Each week, top women's health experts dispel fact from fiction.
The most important pelvic floor exercise is not the Kegel.
Challenge the status quo.
It's never easy to challenge the accepted leaders, and especially if you're a woman.
Provide perspective on why your healthcare journey may be so tough.
All of that fear and worry, it all upregulates our nervous system, puts us into fight or flight mode, and increases our pain sensitivity.
And what you can do about it.
The number one thing is you have to advocate for yourself, and you have to be prepared.
Your journey to get empowered starts now. This is Fempower Health. Each week, top women's health experts dispel fact from fiction.
The most important pelvic floor exercise is not the Kegel.
Challenge the status quo.
It's never easy to challenge the accepted leaders, and especially if you're a woman.
Provide perspective on why your healthcare journey may be so tough.
All of that fear and worry, it all upregulates our nervous system, puts us into fight or flight mode, and increases our pain sensitivity.
And what you can do about it.
The number one thing is you have to advocate for yourself, and you have to be prepared.
Your journey to get empowered starts now.
If you're a person who finds yourself regularly taking 3, 4, 5 medications just to get through your day, just symptom control, right? You're taking some pain medication, some anti-inflammatory, some antihistamine, maybe then you're taking a sleeping pill, and that's a sign. So when you're asking, what should people be looking for? That is definitely a sign that something's not in balance, right? And you're not solving any of these problems, right? Continuing to put Band-Aids on things like that. That's a time to really take a different look.
24 million Americans suffer from an autoimmune condition. That makes up about 7% of the population, and that number is rising. So in today's episode, I interview 2 guests, Dr. Millie Lytle, who is a licensed naturopathic doctor, epidemiologist, and nutrition specialist dedicated to innovatively preventing and reversing the epidemic of chronic disease, as well as Dr. Nicole Bundy, who is a licensed, board-certified internist and rheumatologist who is passionate about improving care for autoimmune and other chronic diseases. And I thought it would be great to bring both Millie and Nikki onto this episode, given their different training backgrounds, because it is really important to have a holistic perspective on such a complicated disease that so many are facing and struggling to get diagnosed and properly treated. So let's dive right into the discussion with Millie and Nikki. So thank you so much for joining. And in honor of Autoimmune Disease Awareness Month, I really wanted to connect with you both because when I did a poll on Instagram around what people wanted to learn about, autoimmune diseases came up so much. And it was interesting because, of course, people wanted to know about specific autoimmune conditions. But after connecting with you both and doing some research, it sounds like we probably need to have a broader conversation of, I have these symptoms and I'm not sure what my condition is and how to be treated. So before we dive into trying to help people get answers to these questions, why don't you start out by giving an introduction and then we can dive right in.
Thank you, Georgie. Thank you so much for having us. Thanks for this opportunity to talk about this really important topic. I'm Dr. Nicole Bundy. I go by Nikki, and I am a board-certified rheumatologist and internist by training. I am currently the medical director at Mymee, and we are fighting a great battle to bring lifestyle medicine solutions to people with autoimmunity to help them gain more control over their own symptoms and their health.
Thank you.
My name is Dr. Millie Lytle, and I'm a naturopathic doctor licensed in DC, and I have a background in nutrition and public health as well. At Mymee, I lead the coaching team and support the delivery of all the care that we do deliver, as well as looking at our real world evidence and our data and working with Nikki on that front.
Well, again, thank you so much both for being here. I actually interviewed Mette Durberg, the founder of Mymee, last year in season 2, and it was such an interesting episode. And I knew when the Instagram folks said, I want to hear about autoimmune disease, I reached out to Mymee and they recommended the two of you. And given your different backgrounds in understanding autoimmune conditions and what you guys are doing at Mymee, I thought it would be so great to have both of you on to really offer perspectives to individuals. So first, let's talk about how autoimmune disease is on the rise.
About 40 years ago, it was clear that autoimmune disease incidence was on the rise. And it's estimated now that that occurrence of autoimmune disease is going up 3 to 9% every year. And that pace is far too rapid to be explained by any kind of genetic shifts, right? I mean, our genes just don't change that fast. So it really is one of the big questions. Why are we seeing such an explosion of autoimmunity? And together with the kind of research that came out of Stanford back in 2015, showing how important our environmental factors are, it starts to give us an answer. We are not eating the same food our ancestors did. We are exposed to innumerable chemicals that, even our grandparents weren't exposed to, or our parents for that matter. Our lives are changing so much, particularly with what we consume, the products we put on our body and use for our laundry and our cleaning, that we know now that those things work in conjunction with a genetic predisposition to trigger autoimmunity.
It's a very interesting connection between our genetics, the epigenetics, so how our genes respond. And as Nikki was saying, that the exposure of the massive and rapidly changing environment and our increasing chemical burden. In fact, it's an uncontrolled chemical burden that we're exposed to and the bodies have to process, is related to congenital conditions. So because with every generation that we're exposed to increasing amount of toxins, the generation prior had to deal with that burden in order for the next generation. In order to deal with it, we know that breast milk has dioxins and pesticides and PCBs, chemicals that persist in our bodies even when they're not used anymore in the environment. So it's a multi-generational issue, and it's a multifactorial causality that we're looking at.
I'm wondering if the best way to start is to talk about some of the common symptoms that people are facing and how they can get on this path of figuring out what is going on. And, I don't know if being diagnosed with this specific condition, I guess it is important because then you know how you're going to have the treatment. But, it all starts with the symptoms. Like, I am a patient, I go to a doctor, I have some things happening with me, and how do I figure out what to do? And time again, it takes years of going to these doctors to figure out the answers. So can you maybe start with that patient pathway of what are some of these common symptoms and how they can start figuring out what it might be and some of the challenges they may face?
This feeds so well into, I know what we want to talk about. Why does it take so long to be diagnosed? Why are people facing 5 years, 6 years, 7 years, going to multiple doctors and only then receiving a diagnosis? So I think that there are a number of reasons for that. But one of the main reasons is because the early symptoms of almost all autoimmunity, not every case, but so commonly, are really vague, right? They can be explained away by, my life, because fatigue is probably the most predominant symptom that's common across autoimmune diseases. Well, who isn't fatigued these days, right? And it's easy to explain that away, especially, women make up 80% of people with autoimmunity, and right, women are doing usually 2 full-time jobs these days, right? We never give ourselves a break. So between fatigue, headaches, no energy, aches and pains, it's too easy for people to just explain that away and to live with it, thinking, well, this is just what it is to be busy and tired and to be getting older, right? So there's one delay. And then maybe they realize, well, this isn't normal. So they go to their doctor. But, right, without any other specific symptoms, it's difficult for a doctor to know. There are no easy blood tests to diagnose autoimmunity. There is no one blood test that a person can do and say, yes, you have autoimmunity, ANA, right? That stands for anti-nuclear antibody. And these are abnormal antibodies that are directed against a person's own cells and tissues. But simply having the presence of an ANA does not mean you have an autoimmune disease. In fact, when I was being taught, the belief was that 5-10% of people walk around with an ANA and it means nothing. Well, that's starting to change. Now we know that if you have that ANA, you are more predisposed to in the future getting an autoimmune disease. But again, it's not diagnostic. So I would say one of the most important things for people to realize is that they know their bodies, right? And if you are trying to explain away fatigue that doesn't get better no matter how much sleep you get, or aches and pains that are not just, a few days and after a hard workout, that you need to find a doctor who listens to you. And whether that's a rheumatologist or a gastroenterologist or your internist, a family medicine doctor, somebody who really believes your symptoms and is listening to you and is not going to give up because your first set of labs happens to be pretty normal.
Yeah, and the hands of these physicians are tied. They have 15 minutes in their office, and if you don't meet the diagnostic criteria, they can't actually take you on as a patient. And that's just the specific nature of our healthcare system. And so there's
we're a sick care system, right? Because we're a sick care system.
Yeah.
And so if you don't meet, like Millie said, these criteria, well, you're not sick.
Right, exactly. So there's a discord between what patients, women are experiencing in their everyday life and what's possible in order for a doctor to treat you with. You can't be recommended to go on a biologic medication if you don't meet specific criteria, nor would you want to. And yet there's this massive gap in time where a disease might be developing. I mean, it might be an autoimmune disease, it might be cancer, it could be another metabolic disease, or you might just maintain this kind of unwell beingness for your entire life or until something drastic changes. And so there is an entire world of practitioners out there who are looking at prevention. What can we do now on the ground from a practical standpoint and not have to watch and wait until my disease just gets, worse enough or until I get sick enough that a doctor will actually pay attention to me, not out of the fault of the doctor, but just the system that they're working in and within as well. At Mymee, we do recommend tracking, and we have it's an educated, experienced, non-medicalized coach who helps guide you through the process of what to track, when to track, and how to identify the nuances between what your body's feeling and how it's responding to the environment around you. So it's an entirely separate expertise than the expertise of specialty medicine, specialized
Right.
medicine.
Do the blood tests for these triggers help or no?
I would say that an individual knows themselves the best, and it's really important to trust yourself. Usually there is an antecedent. Usually there is an initial triggering event that people can, if you create a timeline of your well-being, let's say, when was the last time you felt well? I would ask myself these types of questions. What happened? Maybe it was and it can be, we're dealing with truly multifactorial. There is no one response. There is no one reason for why wheat is not the best choice or pasta is not the best choice for an individual with autoimmunity. Pasta is a refined carbohydrate. Pasta contains gluten. Pasta contains glyphosate on the gluten. And there's also such a thing as how the body deals with or interprets what that protein molecule or those pesticides are saying. So it's all of those things. And it might be related to low vitamin D as to why the body is not responding. So there's all of those things that are individual to the person. So I would say testing can be helpful, but it also can be, if you're doing it by yourself, be prepared to be searching for a needle in a haystack or multiple needles that you can link together. And there's nothing wrong with that. That's what many people are doing, in fact, in order to help solve their own health crises. But there is support available. You don't have to do it on your own.
Right.
And there is a lot of guidance, but these one size fits all diets can be just as much of a problem, even if they're healthy, as not, because then you end up going down a rabbit hole that might help make you better, but also might introduce new issues such as malnutrition, or, when do you get off the diet? Or what if there is a food on that diet that's also not good for you and causing additional inflammation, et cetera.
Right. The technology is getting better, right? And they will be useful. They can be useful. But one thing that I see, the people get these tests and they oftentimes come back with 12 foods that they react to, 15 foods that they react to. Well, that can be daunting, right? How do you take, and they may be things they're eating very commonly, right? And that we'll have to take all these foods out. Oftentimes what that indicates is that they have leaky gut. They have a situation in their intestines that's supposed to be a very selective kind of gateway from inside your gut, which is really the outside, right, into your body. And when that breaks down, whether it's because your microbiome is disrupted and or you have other reasons for inflammation in your gut, then you're leaking antigens across your gut and your body can then be reacting to everything. Get that in order. And some of those foods that showed up as reactive, you'll tolerate just fine. So, there has to be real caution in interpreting some of those blood tests.
So you find the right doctor, but how do you know that you're on the right track?
Like I said, I do go back to, if you are feeling, particularly if you have a family history, it doesn't need to be the same thing you think you might have. If you have a parent who has rheumatoid arthritis or a grandparent who had thyroid disease, and you're thinking, well, no, it's not my joints, and I don't think it's thyroid, but I'm not right. Still, that history of having family members, as you mentioned, with some kind of autoimmunity does place you at higher risk. So you're feeling these things, you get yourself, like we said, a doctor that's listening. And then it is important that some blood work is done, right? It's important that you are assessed for any kind of organ damage or dysfunction that may already be showing up, because those things need to be addressed differently than if it's okay, well, this looks like it's in a pre-autoimmune phase, right? So what I would say is if you go to somebody who is listening to you, doing the evaluation they need to do, and they say, look, your blood tests look okay. You don't have kidney dysfunction. Your blood counts are okay, right? Your cardiac and lung function looks okay if you happen to have those kind of complaints, right? Your iron levels and your thyroid levels, they all look okay, all right? Then that's when you really need to dig in, and you need to find the doctor who says, but I hear you that you don't feel well. So let's support you in looking at the things in your life that could be contributing to this. And that's when I think you can feel safe saying, whether it's the Mymee route or doing it some other way that you can assess your environment and how it's related to your symptoms. That's when I'd say, okay, then you feel good about doing that. Now, if you do receive a diagnosis, by all means, you should certainly still be looking at those things, because any medication, any treatment that you're given is going to work better if you're also removing all the burden of any foods you're intolerant to, any chemicals that you're reacting to, right? The poor quality of sleep that we know now sets the immune system up for dysfunction.
From the testing perspective, would it be just general blood work is sufficient, or is there a way for someone to be prepared when they go into their appointment? Like, for example, if the symptoms potentially seem to indicate more thyroid, again, all the symptoms overlap with these conditions, how can they push for doing research and being prepared to say, what about testing this, this, and this? So like if someone thinks thyroid, they know it should be more than TSH. Because I just, it's just trying to figure out that right level of testing.
Right. And I don't want to push anyone to go get more testing than they need to, right?
Of course.
But I do think, particularly when it comes to thyroid, that's a really common mistake, that just a TSH is checked. And that is checking for thyroid stimulating hormone, which can often be normal in the setting of really frank thyroid dysfunction, right? So I think that without going into all those specifics, which maybe we can cover on another podcast, it is doing a little bit of research on your own for your particular condition, reaching out to the kind of support that Mymee offers, and these practitioners who are doing more than just looking at, do you fit a diagnostic category, right? Digging into more root cause and looking more deeply. Millie, what are your suggestions for folks who, are really looking to get a complete evaluation without like the huge price tag, and without that unnecessary testing?
There's a lot of information that's being lost or leaked from just standard blood work. So for instance, if a physician is trained to look for pathology, he or she might be neglecting the optimal value. So just because you're not out of normal range does not mean that the range that you're in is good.
Vitamin D is a great one for that.
Exactly. And TSH. So we know that a TSH higher than 2 is predisposing for metabolic disease, which is high cholesterol and high blood sugar, which can raise inflammation levels as well as flag any other inflammatory thyroid issue. So if there's trends, if you can look at your lab work over time, for instance, and say, and do a little research on what is the optimal versus the normal range that my TSH should be in, and has it changed over the last few years? Like, if it's under 2 or actually ideally 1, then that's perfect. And even then there still might be something that's going on, but less likely. But if you see it in the 3 area, or like the 2.5, 3, 3.5 or 4, and your doctor's like, no, it's fine, then you want to do some self-advocating. I mean, it really does become necessary to get some education on what you're looking at, if this is something that you need to take on, or pay somebody, or, to help you, which is, there are ranges as to how much that costs and what can be included under insurance, as well as HSA and FSA. But somebody who's licensed, somebody who's functionally trained, naturopathically trained, or even a good functionally trained health coach can help you read your lab work and give you a second opinion on what else to do. Or you can research it yourself and self-advocate, ask for more testing, go to another doctor, go to an independent lab, pay for a lab test, and get the entire thyroid panel checked if that's what you're interested in. I mean, certainly if you have a swollen thyroid, if you have other symptoms, and looking at your body for other symptoms. So if you're suspecting, oh, I don't believe it, I'm cold, I have thinning eyebrows, my hair is dry, I'm photosensitive, so there's other symptoms of low thyroid. It's not just what the TSH, you are not your blood work, right? You are not that's not the totality. That's just an indication. And it's definitely possible and common that things are missed, especially as we're developing chronic disease, because nobody gets diagnosed with chronic disease overnight. Right. Chronic disease brews. That's the entire nature of it. It's like,
even acute disease, Millie, right? I'd argue,
yes.
right.
Yes.
Yeah.
And acute disease becomes chronic as well.
Exactly.
We're born and then we're dying, right? Like we spend the rest of our life. And so if we're thinking like, how do we prevent, how can we turn our health around? I mean, and how you're feeling is an extremely important measurement of how your health is.
Right.
And so that's another thing, to trust, like, as I mentioned before, this timeline of events, it's very important to pay attention to your own body and the signals that your body is giving you. And it takes time to investigate, when am I most tired? Do I have good days? When I have good days, what has surrounded that? What drains me? What gives me energy? And just asking ourselves these basic questions so that we can get it straight in our mind. There's a lot of self-exploration that we need to do, either independently or with the help of, a holistic practitioner like Nikki suggested.
And when you're feeling that miserable, that kind of investigation can be harder than it already seems.
Oh, absolutely.
And that's one of the tough things, right? What we're talking about here, it's not necessarily easy. You tracking everything that you're eating and exposed to and how your symptoms are when you're tired and when you have brain fog, and it gets harder. So support really, really can go a long way to making this doable.
Absolutely. And I also don't want to forget the thought about when you're talking to your doctor, just in case people didn't gather it, is just because your symptoms are different than a family member's who has autoimmune disease doesn't mean you don't tell your doctor that they have that autoimmune disease, because autoimmune disease is autoimmune disease. How it manifests in you may be different than your family member. So it sounds like it's relevant to still say, my mom has rheumatoid arthritis, or my sister has Hashimoto's.
100%.
Okay.
Absolutely.
And I make sure that's clear.
I'd also like to mention that, you may be looking, for some reason, because your sister has Hashimoto's, right? And you're feeling tired and you've been constipated, and you may think this is consistent with thyroid disease. Be open-minded as well, because you may go in and find out it's not thyroid disease. This is some kind of autoimmune lupus-like syndrome, right? Or this is all early RA, believe it or not, rheumatoid arthritis, right? So also it can be hard once you kind of hone in on something, maybe online. I've had people come to me and they're sure they have a certain diagnosis because it was consistent. And it may be, but it doesn't mean that is either all you have or absolutely your diagnosis. So stay open-minded as well.
Okay.
Yeah. I think setting up expectations is actually really important. And granted, very difficult when you're fatigued. But it is so important to find yourself a care team and to have realistic expectations and awareness as to what each member of that team does and what their expertise is. So for instance, your family doctor might be an excellent diagnostician, able to run, tests for you and tell you if you have something or not, refer you to a specialist. But to expect that the family doctor is also trained in supplements and, can give you the time that another type of, more holistic provider can, they can't. You really do need to expand your care team to find somebody who you feel supported by. And that's really important. We have to, and maybe it's not a sign of an imperfect world, right? But we do have to live within this imperfect world in order to find our answers and to work with what's available to us, what's helpful to us, what's constructive. The people who live with chronic disease the best have adjusted their mindset to knowing that they have a team of providers. These, this one does this for me, this one does this for me, and I do this for myself. And it gets easier over time.
So you go to your primary care doctor or your OBGYN, and then you potentially get referred out, right? And we know that for a lot of these conditions, there are pharmaceutical products. I know that with Mymee, there's a lot of things in your program that you're helping people adjust with lifestyle, diet, toxin removal, and all these other things. But I think when we were preparing, you were saying like there's certainly benefits to the pharmaceuticals as well in certain cases. So can you help us just understand what, and I know the world is changing, but from what you guys are seeing so far, are we going to get to a point where if we all change our environment, we can start eliminating these things and having to take all the meds, or not? Are we not even close?
So I would say that one of the things to be aware of is that really the goal of whether it's your rheumatologist or it happens to be that your predominant symptoms are gastrointestinal, so you're seeing a gastroenterologist, you're seeing an endocrine doctor because it's thyroid, whatever it is, their goals and your goals should be aligned.
Okay.
Right? They should also have the goal that they get you to a point where your disorder, your disease, your condition is the least active it can absolutely be, hopefully in remission with the least amount of medication possible.
Okay.
And in order to do that, I'd argue there's no way to really fulfill that goal without taking into account lifestyle medicine as well.
Okay.
So I would say you certainly should be looking for someone who, as Millie said, probably can't do it on their own, but is very supportive of your work to go and explore these things on your own. No one wants the problem of polypharmacy and side effects of medications. And these are real problems. And I think that no, Mymee would never come out and say, we can get you off drugs, because there are people who absolutely, to save their life, require these medications. And we are very lucky that there have been great strides in the treatment of autoimmune disease in the last few decades, but they're not a panacea. They come with lots of side effects, right? They don't work for everyone. Sometimes they work in people and then stop working years later. So that can't be it. And what I would say is, think of it like the way our consciousness now thinks about diabetes and cardiovascular disease. We would never now expect to go to any kind of practitioner to be treated for heart disease or diabetes and not hear about what we should do on our own with our diet, with our exercise to help co-manage this. We would expect to get some medications, right? Maybe for our blood pressure, for our, insulin, but it would be absolute, suboptimal care to not hear what we can do on our own with lifestyle. And that's the way it should be for autoimmune disease.
Fempower Health is pleased to partner with the upcoming Femtech and Consumer Innovation Summit. The summit is the latest deep dive event, part of the Women's Health Innovation Series, looking to tackle this growing sector of women's health, having had continental success in driving innovation, investment, research, and partnerships in traditional women's healthcare by bringing together critical stakeholders. Join us in New York on June 7th and 8th as we channel this success into the consumer sector of women's health. Visit www.femtechconsumerinnovation.com to view the superstar speaker lineup and enter code FEMPOWER15 for 15% off your ticket. Hope to see you there.
There's a picture of, a woman juggling all these medications and kind of, conventional healthcare wisdom, and then juggling all these supplements and lifestyle and meditation and yoga wisdom. And there's a timing over dosage. There's a limit to how much you can take that's going to make you feel better. More is not better. So there's we do need to approach our health with primarily compassion for ourselves, because there's a limit to what we can take, what we can consume, what we can do right now that's going to help us get better. And there is somewhat of an intuitive or, just self-directed way, go towards things that help you feel better, that are supportive, and just work through that. If you take a medication, it should help you. It shouldn't make you sicker. Same thing with a supplement. It should help you. And it can be difficult to understand if that supplement or that medication is helping, but those types of investigations do need to be done, as well as the investigation as to when is enough. Is this hurting me is also very real, which we do hear patients might ask their doctor or their neighbor, is it possible that this is making me sick? No, and be told, no, it's not possible. So we do need to have compassion and patience for ourselves, but then also, it's as much nurture as it is chemical improvement, and more chemicals on whatever side don't necessarily help.
If you're a person who finds yourself regularly taking 3, 4, 5 medications just to get through your day, just symptom control, right? You're taking some pain medication, some anti-inflammatory, some antihistamine, maybe then you're taking a sleeping pill, and that's a sign. So when you're asking, what should people be looking for? That is definitely a sign that something's not in balance, right? And you're not solving any of these problems, right? Continuing to put Band-Aids on things like that. That's a time to really take a different look. And if you've already seen your doctor and that's still where you are, it's time to get a different opinion.
Okay.
And I love that image. I know what image Millie's talking about, a person trying to juggle all the different medication things on this side and all the different things we're bombarded with now about lifestyle changes, right? And I'd argue that you really need a professional to guide you through both of those things.
The body can heal itself. It's not only that we age and get sicker, we can also age and get healthier. We can chronologically age and get biologically younger. And we see this. Women are incapable of conceiving a baby at 30, and at 35, they're capable because they've dedicated themselves to finding out how their bodies can work better. And there are ways to assist our bodies to work better, but the chemicals, whether they be natural or synthetic, can only get us so far. They don't replace the actual awareness, stress reduction, sleep, eating healthy, waste elimination, hydration that we can do for ourselves that have really been suppressed. The importance of taking care of ourselves as we take care of a 4-year-old child has not been encouraged in our medical society. And we really need to return to that in order that our bodies can cope with the stress, chemical burden, environmental challenges of our everyday life.
Can you have multiple autoimmune conditions? And here's why I'm asking, because you were talking about how, if it's gastrointestinal, you should go to a gastroenterologist. If it's, thyroid related, go to the endocrinologist. And, I've seen time and time again with myself, with friends that I know, and you see it on social media posting, like you're basically like, as the patient, without having the expertise, managing a team. And so let's say I'm going to a gastroenterologist and I'm still not getting better. How would I know if, maybe I should add the endocrinologist to my plate?
Yeah, not only is it possible to have more than one autoimmune disease, it's actually not that uncommon at all. In fact, there are a couple of syndromes known as multiple autoimmune syndrome, but those are particular and a particular set of different autoimmune problems. But even apart from those, we see plenty of people. I've had plenty of patients that have more than one real clear autoimmune diagnosis. The other thing that is important to know about this is that the way we label autoimmune diseases like rheumatoid arthritis. Well, rheumatoid arthritis is a systemic illness. It can cause terrible kind of general fatigue and malaise. There are people that get lung damage from rheumatoid arthritis, right? You can get GI problems from rheumatoid arthritis. These are systemic conditions. So, people with psoriasis, right? You think, that's a skin condition. Well, up to 20% of them go on to get an inflammatory arthritis, right? Inflammatory eye involvement comes along with some of these autoimmune diseases that are, thought of as arthritis problems. So sometimes, you're dealing with all these different organs that are manifesting problems. And it is all really because your single diagnosis it is causing all that. It's just, we think of it the wrong way. There's systemic problems. Typically, I'd say, to get in the weeds on it, if you are diagnosed with an autoimmune disease, you are generally seeing a rheumatologist. If it is an arthritis predominant problem, if it's lupus, or if it's a vascular problem. If it's a gastrointestinal predominant problem, which often comes with an arthritis along with it, but something like Crohn's or ulcerative colitis, you're generally managed by a gastroenterologist, but that person will often refer to a rheumatologist to help co-manage if you do develop the arthritis.
Got it.
Thyroid will go to an endocrine doctor. Multiple sclerosis sees a neurologist, right? So if you do feel like you have symptoms that aren't really being fully addressed by your specialist and it's not a rheumatologist, often the rheumatologist is the one then to see, because they're very used to dealing with these, wide systemic problems that come up in every organ system.
Statistic is 50%. Once you're diagnosed with one autoimmune disease, you have a 50% chance of developing a second and a third.
Okay, Millie, it's a great point. If you're seeing any doctor who won't happily speak with your other doctors and coordinate care, you need to see a different doctor.
Where do you see the ideal state and state of care for autoimmune conditions? I imagine it's some sort of cross-functional team where you have the work of what Mymee's doing plus what these specialists do and trying to figure out, where all these triggers are and how the medication fits in. So I would think that that's some sort of generalized ideal state. I'd be curious from this care system of where we need to be evolving to optimize the care that these patients are receiving.
There is a lot of education required, I think, to include a holistic perspective in healthcare. If you're seeing specialists and they're telling you they can't help you, then it's likely a lifestyle issue. Because specialists know what they work with extremely well. They are specialists in that area. And if they don't have an answer for you, it's likely because it's not in their realm. And oftentimes what we're seeing, especially when it comes to inflammatory and intolerance, there's a sidelining of the importance of other forms of knowledge And, historically, maybe it's traditional. And of course, we hear quack and we hear, we hear all of this type of non-scientific pseudoscience. But in fact, what these practitioners do is work with to help reestablish normal physiology in the body, and are paying attention to the details and the nuances of what we're exposed to and what our body's responding to, even if it's before the pathological happens, and even if it's very complicated in terms of generating multi-organ or systemic inflammation. So there needs to be conversations aligning that are integrative between the two healthcare systems, because we definitely live in a multi-tiered system. And there are so many patients in need who are just never exposed to the type of healthcare that they really would benefit from, because, because they're not covered by insurance, or because they're not, supported or known about by the conventional system. And to me, that's an absolute tragedy, because in fact, that healthcare oftentimes tends to be simpler and what you can do at home, and cheaper, and it's cheaper and permanent, which is not to say you don't continually have to work on it, but you invest once, you learn a lot of information, and then you can work with that information for a long time.
We're just so behind in autoimmunity compared to some other fields. I brought up cardiovascular medicine and treatment of diabetes. I mean, you can look at it also the way, say, an orthopedic surgeon works, right? If you go in with shoulder pain, you're going to get an evaluation from an orthopedic surgeon, and he may say that you have, pre-surgical disease, right? And you need just PT, right? It's not just meaning, oh, well, it's, again, woo-woo snake oil. No, it's absolutely healing. You don't need surgery because this will get better with PT. You may go in and they may say, oh, this requires arthroscopic surgery. Or you may go in and they may say, oh, at this point you need a total shoulder, right? Well, that's the way it should be with autoimmunity, right? You should be able to go to somebody and say, listen, fortunately, you don't have organ dysfunction at this time, right? The measures of these important bodily functions are working, but clearly, something's off. Okay. So I don't need to put you on an immune suppressive drug right now, but boy, we need to get on this before you do need one. And that's when these other approaches, these lifestyle medicine approaches should come in, and they should be just as much a part of your medical care as PT is to a surgeon, or, as cardiovascular rehab is for cardiac medicine. Right. And we're slowly getting there. There are plenty of really dedicated researchers who are working on trying to figure out, how do you place somebody in a risk category for autoimmune disease? We're used to this now for cardiovascular disease. You go in and get a cardiac risk score. You come out with a number, right? It combines your age and your cholesterol and inflammatory markers, and you come out. And if you have a high risk, they don't say do nothing and wait till you have a heart attack. They do something about it.
Right.
Change your diet, change your activity level, right? And maybe you need to go on a statin. This is what it needs to be in autoimmunity.
So what would you recommend? Do you, if someone were to prioritize, is it trying to do the lifestyle first or the medication, or does it depend on how severe it is? Because I think you had mentioned that, the medication shouldn't be forever, and they do need to change lifestyle to potentially help the medication work better and potentially get off. So is it the severity that impacts, like, if we were in this world where they finally got it and treated it like heart disease and diabetes, would it be the diet and lifestyle changes that, you're finding are effective?
Would come first, right? I mean, that is, we're not there yet, but that would be part of your regular workup, the way your internist does your cholesterol, your fasting cholesterol, right? And does a fasting glucose and a hemoglobin A1C to see if you're pre-diabetic. That's what should be happening. We're not sophisticated enough to get a good measure of that yet. So people are already symptomatic when they're going in, but I hear you, if somebody's symptomatic, I don't know, Millie may have a different opinion on this. I do think it's worth seeing a rheumatologist. I think it's worth getting that evaluation. There are plenty of great rheumatologists out there, and they can assess whether or not there's something that really is more immediately threatening and needs a more aggressive push. And if not, hopefully they're supportive and can do a little guidance for you to get you onto kind of a lifestyle regimen, but they're probably not going to be able to give you the kind of guidance that would be really supportive, that, as Millie said, that Mymee can do, that a functional medicine practitioner can do, somebody else who's doing integrative care can do.
What I know that can be prevented right now, I've absolutely no problem with people going to a rheumatologist. But the issue is that if the rheumatologist says, I can't help you, I'm sorry, then to be stuck in a 5 to 7 year bubble of being gaslit by every doctor and recommended every other therapeutic, sleep aid, antidepressant, anti-anxiety, laxative for the rest of your life, which is just getting you into further trouble, developing your autoimmune disease worse, when all the time there's an entire field of experts over there ready to help you that have just not been considered properly by the medical system. It's extremely painful, disheartening to watch people have to go through that when the help is there. They're just not being told about it. And we could be preventing so many cases of autoimmune disease. The watching and waiting is just a terrible system. And it's all because of the way the healthcare system triages patients. Yeah, it's because we're based on sick care, like Nikki opened, as opposed to honoring the patient's experience and encouraging the patient to engage in their own lifestyle habits and saying, I'm sorry, I can't help you. You don't have lupus. Maybe you should try gluten removal, or maybe you should see a health coach, or maybe you should do something else, right? That's holistic, as opposed to being, oh, there's nothing wrong with you, which is what patients are being told. If the specialist doesn't know, they're being told there's nothing wrong with them.
And then, like you said, then giving a prescription for sleep aid, or,
chasing diagnoses for the next 10 years that are just inaccurate, going through the pain and trauma and suffering of being misdiagnosed. Also, their body's breaking down because of this polypharmacy and not paying attention to the things where they need to pay attention to, which is their health and, their mental health, their emotional health, and their physical well-being.
I come at this from both the physician, but also patient perspective. So, we don't need to get into that, but I have been through this. So I'm not just speaking from the other side of the desk. I've gone through being on autoimmune medications and not getting help, labs not getting better. So it wasn't just feeling bad. I had concerning labs and ending up, because there was no Mymee at the time, I ended up at a wonderful functional medicine doctor. And I'm happy to say, I'm feeling much better with normal labs. And I did it through diet, lifestyle changes.
Amazing. And it's funny, you prompted me, because that's exactly what I was going to say, is tell us your story. Because I think both of you had your own frustrations where you were and have made this transition because of that. And so, and I honestly, I hear it so much. It's either women who are frustrated, who maybe weren't medically trained, who either decide to go into the field or do something like what I'm doing with this podcast, or someone who was an MD or a different field and is like, that's it, I'm going into functional medicine. So it's a really interesting, I'm really excited to see where healthcare is evolving. People are all trying. I think it's hard because it's a capitalistic system. And my concern, honestly, is there's so many companies that are popping up that I'm concerned now patients will be overwhelmed, because now it's, who do you trust and who's doing an effective job? But I do encourage folks, if you want to better understand what Mymee does, I know we very much glossed over it today. Definitely listen to the episode with Meta Derber, because she goes into great detail about her story, why she founded Mymee, and how it's actually able to help those who are struggling. So definitely encourage that episode. So is there anything that we missed in this conversation? I know we covered quite a bit.
I would just say that I want people to take away from this that even if you've been to 7 doctors, and even if you've been struggling for 7 years and you feel like you've tried everything, right? You can feel better. You can find a life where you are not controlled by your symptoms and at the mercy of whether you wake up feeling well and you're able to do what you want to with your children, with your spouse, for your job. You can, and it's not as easy as taking a pill. It simply isn't, but you do have some control over it. It's heartening.
I agree with all of that. I mean, I think that it's extremely new territory for many people to consider themselves as an active participant in their healthcare in a way that breaks the mold, goes beyond what their doctor's telling them. But there is that option of investing in yourself in a different way in order to find the results. I mean, if the route that you're taking right now is not helping you, then turn to the left instead of to the right. There is help for you. So that's what I'd like people to know.
Really interesting. And I'm excited about where this field is going. So I actually do have one last question if you have a minute. I want to know, what is a fun fact about you that you want to share?
I'm a massive Dylan fan.
Are you?
Yes, I am. That's my side passion. If I could go back to college and get a new degree, I would get it in Bob Dylan studies. And
no way.
Yes, I absolutely love his. I really love his message for the people, for the times, how he explores the emotional realms. And I'm a super fan. I travel around to see him play.
No
I'm in a Dylan fan club, and at 80 years old, he's just the best. I think he's the best.
Oh my gosh, that is a really fun fact. I have a neighbor who's like really into Dave Matthews, and she gets tickets 3 weeks before they go on sale and is like posting on Facebook all the time about it. It's hilarious. I love it. What about you, Nikki? You're smiling. Did you come up with, what's your passion?
Trying to come up with something that's fun or interesting. I will say that before deciding to go to medical school, I was a drama major. And
Ooh.
I still have, I'm not giving up hope for that Oscar one day. So when I finish with this, that's what's coming next.
Oh, that is not, see, everyone has a fun fact. I know that when we're with ourselves all day long, we think it's not interesting, but I think both of those are so cool. And I really appreciate you sharing. I'm sorry to put you on the spot, but I think it's fun to do it on the spot because then people really have to think and it gets a smile on their face. Thank you so much.
Thanks.
Thank you too.
Okay,
Bye,
bye-bye.
Bye, Nikki.
Thank you for tuning in to this discussion on the Fempower Health podcast. You can refer to the show notes for links to information that is referred to in this episode. And if you like this episode and found it timely and valuable, please take a moment to tell a friend or a colleague about Fempower Health. And right after this episode is over, please think of one person who might find this episode helpful and tell them about it. And if your friend is new to podcasting, please show them how to subscribe to our show. And another way to support Fempower Health podcast is to leave a review where you listen to podcasts. And as a reminder, the information shared by Fempower Health is not medical advice, but for information purposes to enable you to have more effective conversations with your doctor. Always talk to your doctor before making health-related decisions. Additionally, the views expressed by the Fempower Health podcast guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. See you next week. Thank you for joining us on another enlightening episode of Fempower Health. No matter where you are in your journey, our website is brimming with content tailored to your specific topic of interest or life stage. Dive in and discover the resources and insights waiting for you. Your voice matters to us, and if you found value in this episode, please take a moment to write a review. Your feedback not only helps us improve, but it also helps others discover our podcast. By spreading the word, you're empowering women everywhere with the information they need to navigate their unique health journeys. And if this episode resonated with you, please don't keep it a secret. Share it with friends, loved ones, or anyone you believe would benefit from the information. Together, we can create a world where every woman feels supported, informed, and empowered. Remember, knowledge is power, and Fempower Health is here to guide you and support you in every step of the way. And as a reminder, the information shared by Fempower Health is not medical advice, but for informational purposes to enable you to have more effective conversations with your doctor. Always talk to your doctor before making health-related decisions. Additionally, the views expressed by the Fempower Health podcast guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Until next time.